There has been a recent spike in COVID-19 cases across America, with COVID hospitalizations almost doubling in the last month. Because of this, Berry students have raised concerns about its potential spread. Dr. Jimmy Douglas, the medical director of Berry College, shed some light on this recent spike.
We're seeing an uptick in the cases, and I think a lot of it is being because of we're back in school, we've had really hot weather, people have been inside, air conditioning, and whenever you group people together and you schools get back in session, we have more exposure to each other. Therefore, if there is any COVID out there, you're going to see an uptick in it. The same with, we're fixing to hit respiratory disease season also with flu and RSV, and we're going to see more diseases like that in the near future.
COVID-19, like other respiratory viruses, can spread through multiple pathways. It can spread through the air, from physical contact, and being in the vicinity of other people. Therefore, it is important to self-isolate if you catch the virus. Dr. Lauren Wehunt, director of the Health Center at Berry College, details the precautions someone should take in case they're diagnosed with COVID.
We are following a CDC-based guidelines, and that is you are isolating for 5 days from symptom onset. So the day your symptoms started would be your day 0, and then you would isolate for 5 days after that. As far as notifying your exposees, those that you potentially have exposed, you want to go back 48 hours from that initial symptom onset or when those symptoms start. And then exposure protocol has not really changed per CDC policy. We want you to mask for 10 full days if you've been potentially exposed, and then test on day 5 from last known exposure. But if you become symptomatic, obviously testing earlier is important.
With Viking Fusion News, I'm Roger Thomas.